Want me to go see it?
And sometimes it's ready before you text them the email.
I can message him on Zoom. I can message him on Zoom.
All right, everybody, good afternoon. Let's call the Larimer Regional Opioid Abatement Council meeting to order. It is December 4th, 2025, 2:01. We'll do a roll call because we do have several folks on virtual, and it's hard for me to see. So what I'm going to do as voting members, I'll just call the jurisdiction, and if you are here, then we'll make sure that we do have a quorum. So I'll start with the town of Estes Park.
Hi, I'm here.
Thank you, trustee. Wonderful to have you. The city of Loveland. Is Amy with the city of Loveland available? Okay, I'm being told that she will be arriving late, so we'll move on to the city of Fort Collins.
Yes, sir. Good afternoon. My name is Chad Wright. I'll be sitting in for Rupa today.
Thank you, Chad. I appreciate that.
Thank you, sir.
And welcome. Larimer County Government. Commissioner, are you on?
Yes, I am, sir. I'm here and
All right.
I will be listening as best I can. So sorry, I just could not physically get here to both places. It's just a 20 more minutes of driving. I could have been there, but I'm here virtually. Thanks.
Wonderful. Thank you, Commissioner. Appreciate it. The town of Wellington.
Great to be with you.
Wonderful. Thank you, Mayor Pro Tem. And representing the Board of Health is me, Tom Gonzalez. We do have a quorum. Wonderful. So we will get moving along. Before we jump into public comment, I do have one of our council members that has shared with me that he would like to provide an update to the council. So Shane, I'll turn it over to you.
Thank you, Tom. I want to say that it's been, I'm going to stand up. I'd like to say that it's been a great honor to be a part of the Opioid Abatement Council here in Larimer County. I will be resigning as of today. I have other things and places I need to put some energy. It has been such a pleasure to get to know so many of you on this council and people in the community doing this hard work. It's bringing tears to my eyes. The work that this council has done so far is impressive. It's making a difference out there, right? For those of us who are spending time out there, I think we know this, we're seeing it. It is my hope that this seat, this name placard, right, are given to someone a bit like me, but not much like me at all. I'm hoping that someone, right, from some other areas of our community is brought into a seat on this council as an advisor with lived experience. My experience in addiction and recovery was obviously very much privileged, right? I'm a white, cis, American, straight male. I think we need those voices here and elevated, right, and encouraged on a bigger scale. I think also someone a little closer to what is going on right now in the landscape of the opioid crisis. Maybe even someone with living experience could be of great benefit to this council. I don't want to be too long-winded, but as I leave, you know, there are times I have felt invalidated, and there are plenty of times I have felt heard by this council. And moving forward, and in any council, it is my hope that the people who are brought in with lived experience are never made to feel invalidated. As they share their lived experience, right, that was brought through a lot of pain in a setting like this. This is not always a comfortable place to be for someone who's not familiar with being in these spaces. Elevate those voices, right? Make people feel heard and encouraged, and continue the great work, you know, continue the great work. You're all making a difference. And that would punch me. You guys are doing great work. Thank you so much for the time I've been able to spend here.
Well, Shane, I thank you for those comments. And I appreciate the leaning into vulnerability and providing clear feedback. It is always the goal to be inclusive and provide two-way communication where everybody feels heard and feels validated and feels safe. So there's things we can do better. I sure would like to hear those because we want to be better. You have been invaluable in the sense of providing lived experience. I've learned a lot. And it's changed my thinking as we look at public health and prevention, treatment within prevention, the recovery within prevention, harm reduction within prevention. I think we as a community are working harder and better because of your feedback, your insights, your thoughts. You're sharing what worked, what didn't work. And just because we disagree or doesn't disagree, it's the information, it's the feedback loop that makes us better, that makes us more informed, that makes us more thoughtful. So thank you for your time on this council. You have done so much to help drive the work, the activities and initiatives that are hopefully going to lead to less deaths from opioids and less people even doing opioids. So thank you very much.
My phone line is always open.
Wonderful.
We have had some folks raise their hand in the chat.
Wonderful.
Youngman and the commissioner.
Well, let's start with Trustee Youngland, please.
Thank you, Chair. Just to share I agree with your comments. Sorry. Shane, I just really appreciate the time you've spent with us. I couldn't agree more with what the chair just said. You've been invaluable, and hopefully we can continue to see you around and always be welcome to share any thoughts that you may have as we move forward. But I won't take any more time other than I wanted to personally thank you for your time and your dedication to this.
Thank you so much. And my phone line is always open for you as well.
Thank you, Trustee. Appreciate that. Commissioner.
I don't want to repeat what everyone said, but I do agree. Thank you, Shane, for your service. As this council came into fruition and we had started to roll, we didn't have people with lived experience, or sometimes they call it consumer advocates, but I know we have to be careful with all that language right now, but I just wanted to thank you for joining on as we looked to have multiple people of lived experience on the council. It's important to have differing perspectives, and sometimes we don't always align and agree, but I think we all have the same mission to save lives and to do what we can to mitigate and reduce harm and make amends. As you had said, that was one statement I think that stuck with a lot of people about making amends, and I think that's really important words for us to think about and consider as we move forward. We just had the opioid abatement conference, and it was really important that we had that feedback from all those folks at that conference too. There was a really good panel on that about nothing for us without us, and it was, I believe MJ was on that. It was a really good conversation, a good reminder. And so I know you're doing a lot of work in the area, and I appreciate you're really trying to still be a strong voice for those who feel like they are forgotten or don't have a voice. So just want to thank you for your service.
Thank you so much.
Thank you, Commissioner. Are there any other? Anybody else want to make a comment? Again, thank you, Shane. Appreciate you. Look forward to working you on others. Before we go to public comment too, this is the last meeting of the calendar year for the Regional Opioid Abatement Council. We try every year to do something that's nice and cost effective. We do some cookies and some soda water. Please help yourself. Thank you for everyone's participation. It's a collective effort to actually do the good work we're doing. So thank you. And big thanks to Heather for going and getting the goodies for us today. So please enjoy. We don't want to have to take them back to our office. All right. We will get to public comment. Is there anybody that would like to make public comment to the council, anything that's not on the agenda? Anybody online? Okay, I want to make sure I don't miss it. Okay, we'll move away from public comment and go to approval of the October 23rd, 2025 meeting minutes.
Mr. Chair, I'd like to move to approve those minutes as written and presented.
We have a motion. Do we have a second?
I'll second that.
We have a motion second. Any further conversation regarding the minutes? Hearing none. Does anybody not approve that motion? That motion approves unanimously. Okay, we'll move on to the 2025 annual report. Those that are in the room, we've got some reports here. It was in the packet, correct? Okay, I can't remember because there was a holiday in between and I lost my mind while I was out. We did this last year as well. This is the health department's communication team takes the information from Janelle and John and others, and they put together a one-page front and back kind of annual report. There is a requirement from the Colorado Opioid Abatement Council that we are transparent, that we disclose the amount of funding, where the funding's going, which is important. We should be doing that. So this is our simplified way of doing that. So you'll see we've got our beautiful logo and then the basic narrative of the report, are how much money was awarded, the 6 areas, including prevention, harm reduction, treatment, administration, recovery, planning, and coordination. On the back, the organizations that were awarded and what their work is they're doing. Some funding by area. I really love our communications team. They did it by bubbles this year instead of a pie chart. So just a different way of showing it. And then again, our areas and what we're trying to focus in on with the continuum of care. So any feedback or questions or anything else regarding the report? Seeing none, what would probably be best is that the council adopts this through a vote, so then we can make sure we put it in areas, we share it with our governing boards and that to make sure they're aware of the work we're doing. So I would entertain a motion if that's the council's desire.
I'll make a motion to accept the 2025 annual report.
I'll second.
Thank you. We have a motion and a second. Any further conversation regarding the motion of accepting the 2025 annual report? Hearing none, does anybody oppose the motion? That passes unanimously. Folks, there is a stack of beer if you'd like to take one for the road. Okay. We will make sure that gets put on the website. And then I do encourage all of you to take it to your governing boards, councils, and share the information so everybody's in the loop on what we're doing here. Moving to item 5, grant administration. We do have 4 items there. One's a final report and 3 are 6-month reports. So let's start with the Harvest Farm final report approval. We keep these reports a little bit longer than the 6-month, but we know Kyle knows these. He's done them before. So we'll turn it over to Kyle McPherson from the Harvest Farm. Kyle, welcome.
Yeah, and I'll make my intention to be pretty concise with both because you have me not once but twice back to back with 2 different reports. So I won't go into Harvest Farm in a description. I think I've done it so much that poor Jessica could come and do it for me much better, much faster than I can. But as a background, this initial final report is regarding the additional 8 beds that we were working at Harvest Farm. So if we go to the next slide, please, that'd be great. So the goal, we had 5 main goals. The first being to add 8 beds to Harvest Farm. So we want to increase our overall capacity for the New Life program, which would have brought us from 72 beds to 80 beds. We then had 4 subsequent goals that were related to 1 year post-completion. So if you see on the slides here, we want to increase capacity from 72 to 80. We wanted to increase total number of graduates. We wanted to increase participation in our small groups. And then we also wanted to go ahead and increase total participants in the program we saw. We are on track right now to finish our construction in February, which the rest of these slides will detail the delay, what we've ran into, the hurdles that have come up. But as you can see, regardless of having not yet completed, we are still striving and making great progress in our service delivery at Harvest Farm. So we have already graduated 55 individuals for our current calendar year. That's up through November, with still a month to go with graduates that are coming every single day. We have worked towards increasing group engagement. We have 124 individuals who've engaged with groups so far this calendar year, bringing us to 83% of our goal, which was again supposed to be 1 year post completion of our renovation project. And then we've had 148 individuals already participate in the program this calendar year, with the goal again was 155 post completion of our project. So we can go on the next slide, please. So I remember when we initially presented on construction and building, Commissioner Shattuck McNally made a comment that it is a lot more complicated and can take a lot longer than you would anticipate. She was absolutely correct. We have hit hurdles that we did not expect, yet we've persevered and pushed through regardless. The first of which many of you are aware of, in January, we had some major issues with our main septic line. So much so that we had to bring on mobile restrooms, mobile showers to the tune of $20,000 a month while we had those in place. So that became our main priority. We had to upgrade our septic system, replace it. A few of you came on and toured and saw what a big undertaking that was for us. Fortunately, we got that completed, which was fantastic. We then progressed. We presented our initial layout and design to you all, which was to renovate our basement. Renovate the basement of one of the buildings on our property to add 8 additional beds, as well as some additional office space for increased capacity. Well, fire came in and they said we would need a sprinkler system to the tune of over $120,000. Very quickly, that made the project not possible from that standpoint. We then pivoted again. We wanted to go ahead and say, well, we'll do it all on the main level of one of our buildings. We'll go ahead and renovate that, and we will add in additional office space and 8 beds. The office space was going to be paid for by us as an organization. We came in, we presented those plans. We then found out that Harvest Farm, where that house sits, is on a 100-year floodplain. And we were told that if we were to do all of the renovations that we intended to do, we would have to find a way to raise our building 18 inches off of the ground. And this is for reference for those of you who haven't seen it. It looks like a residential house. In fact, we're so creative with how we name things, we call it the big house. Is the name of this building on our property. So 18 inches was not possible, not for us. It would make more sense to tear it down and build something new at that point. So we then had to change the scope of our project again. We had to reduce the total capacity, not capacity, but we had to reduce the total cost so that way we did not exceed 50% increased value of the house. Because after you hit that threshold is when you're required to get into codes with the floodplain. So we changed again. Our architects actually stated that this was such a new thing for them. They brought in all the architects from the region to meet with and do a case study on it because it was very unique progress, very unique process and learning opportunity for all of them. However, we persisted. We persisted and we got our final permits approved and we started construction on November 19th, which is fantastic. So we are on track, as I said, to complete in February of 26, adding 8 beds. And increasing the overall capacity of Harvest Farm, which is very exciting for us. Yeah, next slide, please. So this is all in your handout in the packet that everyone has, but it's really just a representation of the work we've been doing and the process that's been taken. We understand that the Opioid Abatement Council invested a large amount of funding, and so we really just wanted to represent and show that we have been actively pursuing every avenue to increase our overall program capacity for the duration of this time. Next slide, please. Here's what we have done funding-wise, what we've spent regarding permits, engineering. We also put a deposit and pre-ordered a number of materials. There were some of our staff who realized that with upcoming tariffs that could increase the overall building costs. So we did pre-purchase our materials and have those on site while renovations and construction is actively going on today. And then next slide, please. So 2 things that I'm here to request today. The first is a final extension to February of 2026 to complete the project. The next is I want to be transparent with something we'd like to reallocate. So initially in the project, we had $10,000 to account for increased utility expenses. So what that was accounting for if we're adding 8 more individuals into our program, that's going to increase the utility costs for our entire program. However, we also recognize that in order to keep that 10,000 open and spending would require that we leave our agreement open for an additional year after the construction is completed. So what we are instead proposing is that we be able to use that $10,000 to move our washer, our laundry room into our newly renovated and added septic. Because with the additional 8 beds, we have discovered also that our laundry, our bathhouse, would exceed the capacity of the one that was connected to. And so we would then need to move the laundry line to our current upgraded septic system that we did back in January. So those are our 2 requests as of today. I would welcome any questions that y'all might have.
Questions from the council members? Yes.
What would the fallout be if you weren't able to make that change?
The $10,000?
Yeah.
We would just reallocate it elsewhere. And so if it was the desire of the council for us to spend that on utilities over the next year after we complete the renovation, we can do that. And we would certainly spend it. My understanding though is that would then mean that our agreement with the council would remain open for an additional year for that $10,000 as we spend it down. Our thought was that it aligned because it is for laundry, which in our initial application was spoken to, was as one of the increases in expenses we would have.
Thank you for the question.
Yeah.
Any other questions? Yes.
So the house is set to be finished by February?
Mhm.
Do you want to put in some buffer time in case that has any other delays?
That's a great question.
Do you mind repeating that? Because I didn't even hear it.
Yes.
Because there's a fan going.
I asked if they'd like to put in any additional buffer time since it's supposed to be completed in February, that with all the other hiccups, it might make sense if you're asking for an extension to ask for additional month or 2. That way, when it is up, you have time to give yourself more time.
Yeah, I mean, I can say very confidently, we would not deny any additional time. However, the February timeline is with us adding a little extra buffer just in case.
Okay.
So although I very much love you guys, I would rather not have to come up and ask for another extension here.
We do have 2 hands raised in the chat. I believe the first one was Commissioner.
Commissioner, you got your hand raised, please.
Yes, I just wanted to clarify with staff, you know, we've had a few of these, and I know we put some changes into the bylaws of how of criteria or what we look at to reallocate in the amount and stuff. And I wanted to just review that really again quick about, because I think we've done this once before for another organization. I just wanted to know if staff could kind of remind me of what we had put in place to have some guidelines or criteria for this. Thanks.
Thank you. The other hand.
Was Trustee Young.
Trustee Youngland.
Yes, thank you. Yeah, I agree with Commissioner to just make sure that we're okay with that. If that follows our guidelines, I would be ready to make a motion to accept the request for the extension and also for the reallocation of that $10,000 to laundry.
I will second that, Mr. Chair, but I just want to make sure, I know probably staff have looked at that, but I just want to get a affirmation or confirmation that this, or by David or staff, that this aligns with what we had put in place from the previous experience with this, with some money that had to be reallocated. And I can second trustee's motion after just that confirmation. Thanks.
Yes, good question. David, are you on?
I am, and I'm frantically reading through the approved purposes. So to answer the question, I think on what area or how it would fit in, we do have, let's see if I can find it again. Section E of the attachment that outlines our allowed areas. It's a little broad. It says the full continuum of care of recovery services for OUD and any co-occurring substance use or mental health issues, including supportive housing, residential treatment, medical detox services, peer support services, and counseling. It doesn't address how it would be spent for supportive housing or residential treatment. But if there's some clarification that the funding is somehow used in order to achieve supportive housing or residential treatment, it does appear to fit under that broad category.
Thank you,
And
David.
David, I just wanted curious about the capital policy we had approved. Is it that we also had that capital one as well? Does that,
We may
does that
very well
align?
have a capital policy. Is anyone in the room that has that policy with them by chance?
I think we approved it 2 or 3 months ago, but I just don't have it in front of me, and I was hoping that we could at least make sure it aligned that with that as well. I'm thinking staff looked at that, but I just wanted, like I said, wanted confirmation. Thank you.
I do remember the policy. Was that, there was a limits and some thoughts on the policy. So do we have that available, staff, for us to?
I was able to pull it up.
Yeah.
Pardon?
We have it available.
Okay.
It might take a second.
Thank you for pivoting so quickly.
And part of our question as well, again, was if it would actually need to be a reallocation, since the $10,000 was for utilities, and this is directly for increase on our program capacity. So
Thank you, John, yes.
The ROAC council has approved, their policy says you can reallocate up to 50,000 before you have to ask for permission.
That's in the.
Oh,
And it's in the grant agreement.
okay. Did you
Yeah,
hear that,
that's-
Commissioner?
Yeah, that's why I wanted to ask, because I knew there was a limit, and so I wasn't sure what that was. It was 10,000 or 50,000, but I think, did we make it 10,000 or did we leave it all the way up to 50,000? I thought we made it smaller.
No. That's separate from the capital policy, I believe.
Yeah, the capital policy, but also with reallocation, we had also made that some kind of motion or move or change that too. We lowered it from 50,000 down to what, 10. So maybe I'm incorrect, but I remember that, but maybe I'm, I've been in so many meetings lately. They're all starting to blend into one. So, but if it lines with the policy, then I'm again supportive if we need that motion.
We're good. Yeah.
Sounds like it aligns with it, Commissioner. So would you like to make that second?
Yes, thanks.
So we have a motion and a second. Any further conversation regarding the request to reallocate the $10,000? Not see any. Let's, does all those in favor, please signal by aye.
Aye.
Aye. Does anybody oppose? Passed unanimously. Great. Thank you.
Yeah, of course.
All right. Any further questions for Kyle while he's here regarding the harvest?
It's like trustee Youngland has raised her hand again.
Trustee Youngland, please.
Yes, I just wanted to commend them, the Harvest Farms, for being persistent in, on their quest to add capacity. You've certainly been thrown a lot of wrenches in your plans, and you have come out, it looks like you're going to be coming out victorious. So thank you so much for providing this information and being persistent in your goals.
Yeah, thank you very much. You're very welcome.
Well said. Well said, trustee. I agree. And anybody who's ever dealt with failing septics and this and that, it can be very difficult, challenging, and very expensive. Anything else for the Harvest Farm? Thank you. Appreciate your great work.
Very welcome. You're stuck with me again.
I see that because now we got the 6-month report, Fort Collins Rescue Mission, and it's Kyle again.
It is. Hello.
All right, Kyle, welcome.
Kyle McPherson. It's nice to be here with you today. I guess first I do want to say, because Commissioner, it's something you ask quite often around opioid use of those that we're serving. And so we, as a result of this council, have started taking active steps to track individuals with experience surrounding opioids specifically, not just substance use disorder. And so for our current calendar year, of all of those we've served and worked with, 68 have a history of opioid use disorder. So I bring that up because I know it's been asked frequently and regularly, and we want to ensure that we're including that in all of our reports.
Got heart emojis.
I'll take heart emojis. That's right. Okay, lovely. Next is Harvest Farm and Fort Collins Rescue Mission. It's our 6-month report. And so you'll recall, this was to fund 2 community life coordinators at Fort Collins Rescue Mission. These are staff on the front lines, and their positions allowed us and have allowed us to offer 24/7 operations and 24/7 shelter for individuals experiencing homelessness here in Fort Collins and Larimer County. The other side of that was for 1 case manager at Harvest Farm, and then for 1 intake specialist. In fact, it was this council who helped us convert and make a full-time intake specialist, not only serve those coming into Harvest Farm, but to be an active presence at Fort Collins Rescue Mission, working to serve those most vulnerable and help them bring them out of our shelter and bring them into recovery services if those are needed. And so those are the 4 positions that have been funded. Next slide, please. So Harvest Farm, 6-month to date, you'll notice it's slightly different than our annual report that we just shared regarding Harvest Farm. That's because we're going off the 6-month review period that is for our grant. So for that time period, 28 program graduates. For reference, that's 28 individuals. In order to graduate, you will have been with us for about 6 to 7 months. You have developed a pro-social community of supports. You have income sufficient to support yourself. You're no longer engaging in destructive habits, which means you are clean, sober, not actively engaging in addiction. And you have found housing. You have found more stable housing. So you are leaving our program with those things intact. And so for this period, we've had 28 individuals meet all of those metrics, which is fantastic. In addition to that, 47 individuals have obtained more stable housing because you don't have to graduate to exit into more stable housing. 44 individuals obtained employment, 58 connected with mental health counseling, 63 connected with psychiatric care. Then I'm going to skip down to the one that we've been most excited about is that you'll see we have significantly increased the number of individuals coming from Fort Collins Rescue Mission into Harvest Farm. And that is the direct result of us being able to have a full-time intake specialist dedicated to helping reach those most vulnerable in our community, which is really exciting. So that's gone up to 46 just as of November 20th. And due to some other events, the fire at Fort Collins Rescue Mission, that number has been spiking pretty frequently. Next slide, please. Fort Collins Rescue Mission. This is what we have for the same time frame. 14,800 auxiliary shelter nights. So that's over 14,000 nights where individuals have stayed with us and received shelter. 476 unique individuals, 174 new to Fort Collins Rescue Mission. We're receiving on average right now about 20 new individuals per month to Fort Collins Rescue Mission. And then dependent on 24/7 shelter, which I'll get to, 440 case management appointments, 171 instances of someone attending group, and then 14 individuals have obtained employment. Next slide, please. But this is what I really want to speak to, because this has been a particularly difficult time for our organization. Part of the funding from this council has been so that we could provide 24/7 operations. That has been the goal. So those 2 community life coordinators, this council stepped in when we lost funding from another body to provide that so we could provide safe, stable places for individuals to be during. We were hit with a very unfortunate fire that has drastically disrupted our operations. We have moved over to 117 North Mason. We're operating an auxiliary shelter. We have capacity there for 70 individuals, which means that we are about 89 to 90 beds short of where we should really be right now for this time of year. We have, since the fire, we have had over 800 instances where we've had to turn someone away. And that continues to go up as it gets colder. but we are actively pursuing and doing everything we can to meet the need that's here in our community. So I bring this up because I want to give an accurate representation of why we're not providing the 24/7 shelter the way that we had committed to. Next slide, please. We are nothing if not a creative organization. So we, in response to the fire, again, we have moved over to what was typically our seasonal overflow shelter. So we have 70 individuals who are able to stay there. Case management is now being done out of the Old Town Library. They have very graciously given us a permanent space that we can operate out of. We have been working to get more individuals into Harvest Farm than have ever gone there. So we now have our intake specialists that this council funded through this pot at Fort Collins Rescue Mission twice a week, holding groups and engaging with individuals who may want recovery services. And as we see it getting colder outside and getting more dangerous and precarious for the unhoused individuals in our community, we do see a lot more individuals taking advantage of the opportunity to step into recovery at Harvest Farm. So that is our current process and where we stand. Next slide, please. So goals for continued funding. This is just a recap of the goals stated by the council through our application. Increase admissions from Fort Collins Rescue Mission to Harvest Farm. This has skyrocketed, as I said, for the reporting period, though it was 26. We expect that this number, our annual number will probably double from what we typically see, which is great and very exciting. Sustain Fort Collins Rescue Mission participant engagement in small groups. As a result of the fires, you can imagine it has drastically reduced our ability to hold small groups because at the space we're in now, there aren't private offices. There aren't private spaces to hold groups. So as a result, what we have done, and this will be starting now, is we have our intake specialist is holding groups open. And we are also now, our case manager at Fort Collins Rescue Mission, continue to bring men who are interested in recovery to Harvest Farm and take a tour as a way to engage with them. So we are trying to be creative in the services that we offer and render to those who are staying with us. And then finally, again, maintain 24/7 shelter operations. So as of now, and I'm saying as of now, multiple times, our plan and our expectation is that we'll be moving back into Jefferson sometime in January. That is the goal today, where we will then increase our overall capacity, number of beds that we have in order to meet the need in our community. But I'm reluctant to promise and overly commit to anything related to buildings, as is represented by my previous presentation. But January is the plan as of now, and we're really hoping that we can do that as quickly as possible. Next slide. Any questions?
Any questions? Hands up.
Nothing from online.
Any questions from other council members? Well, I would like to add that, yeah, that fire is tragic. How you responded and just, getting creative and using our community resources such as the library and other pieces. It's wonderful to live in a community that we collaborate, we care. But yeah, gosh, my heart goes out to your whole mission there with that fire and how it sets you guys back. But how you responded is amazing. So yeah, keep up the great work.
Thank you. The community response was amazing. That night, the Red Cross got involved. The city sent buses out. We brought everyone to the Mennonite church. We got them over there within a few hours, and then very quickly stood up our auxiliary shelter. So we're very grateful for all the support we have.
Well, I do need we have an action here to accept the 6-month report and distribute the remaining funds.
Also move, Mr. Chair.
We have a motion
Second.
and a second. Any further conversation?
I too want to commend you for this part as well. You guys are just, I don't know, pretty fascinating to see all the creativity that has come out of these difficult tasks that presented you guys both at Denver Mission and out at the farm. So job well done under horrible circumstances.
Thank you. Thank you very much.
Any further comments? Hearing none, we'll take the motion to vote. Does anybody oppose the motion? Hearing none, that passes unanimously. Thank you, Kyle.
Thank you guys so much.
Great work. Appreciate it. Okay, we will have now Rise Above come with their 6-month report.
Kyle, you don't want to do this one? I mean,
Why not?
thanks, everyone. Those that don't know me, I'm Kent McLennan. I'm the Executive Director for Rise Above Colorado. Appreciate the opportunity to share progress with you at our 6-month point on this grant. We can go to the next slide. For those that don't know, we're a statewide substance misuse prevention organization that empowers youth to make healthy connections, decisions, change. In this particular project, as a reminder of its focus around school-based programs and supporting the deployment of the Connect Effect, the statewide fentanyl awareness campaign that started out of the Attorney General's office, maintaining that locally specific Larimer County version of this campaign for youth 10 to 18. And then the continued deployment of resources in schools in Larimer County around opioid and fentanyl prevention. Next slide. In terms of where we are on the Connect Effect campaign, we have finished our flight for this fall. We're taking a break because the holidays is usually not the best time from a cost efficiency standpoint to be doing a lot of marketing from an online perspective. So our flights are complete for now. What you'll see the result, we did have carryover funding, which we noted from a couple of months ago that completed in September. That campaign from that carryover yielded about 670,000 impressions. And we continue to have strong response with the campaign. The click-through rate of those that are seeing the ads and then clicking through for more information to the website is more than double the industry standard rate for all platforms. It's typically Snapchat and TikTok are where we are primarily, and some Instagram. And then the flight we just completed in early November was about 750,000 impressions there. And then we're, as I said, taking a break and then relaunching the remainder of that allocated campaign from January through April till the end of the grant. And the other note I'll make with respect to both the campaign and more broadly, part of the grant allocation was for the ability to oversample data from Larimer County and collect additional responses as part of our statewide Rise Above Colorado Youth Survey. It's a biannual youth survey that we conduct. It's complementary to the work of Healthy Kids Colorado, which I know Larimer County has data for that, but provides a sort of a deeper line of questioning on a variety of topics, including awareness levels of campaigns like the Connect Effect. So we'll be able to see what the awareness level is like and what we might be able to correlate with that in this 2026 data. So the collection for that will begin at the end of February and run through the spring, probably until about March. And then we'll be doing analysis from that point forward. So we probably won't have the analysis done by the time that this grant comes due, but we certainly will by the early part of the summer. And so that's next on that. Next slide, please. Ad samples, just as a reminder of this locally based campaign in terms of using the data, and that's the other value of the survey that we will do, is gives us another chance to revise these kind of numbers and use additional ones of additional norming statements that we might be able to say about what Larimer County teens think or do. Next slide. On the second objective, we've had a good opportunity to work over the course of this year on a differently funded project to revise our not prescribed lesson. That's our educational resource that this grant has been based around in terms of getting more Larimer County teachers trained in being able to use this sort of single day lesson in classrooms in the various school districts. We had a representative actually help us from Fort Collins High School that we met through this process that sat on our advisory group to help remake this this lesson. It will be available by January as part of our rollout for the teachers that are going to be using it here in Larimer County in the next 6 months of the grant. So that we were really excited about being able to do that. Next slide, please. In doing so, as I said, this will be ready in January. If you recall from our previous year's grant, the vast majority of teachers that we trained for this not prescribed lesson came from Poudre School District. And we had about 2,600 youth go through that program as part of the last school year. Most of that training happened in the second semester. So we're anticipating that while we have some youth that have been trained to this point where they've used the lesson through the date when we reported in early November, the vast majority of that we anticipate will be in the spring semester. So more updates to come on that, and we're excited about having some new content and a little bit easier lesson to use in a single day session in schools. And just reporting on the 3 school districts, as I mentioned, Poudre School District has been extremely supportive in training and then doing the delivery on this. And we anticipate with our support from the Fort Collins teacher that coordinates across schools that'll help. Again, for that, Estes Park, we have trained educators, and their plan was to deploy in early 2026. So they are sort of on schedule for what they hope to do. Thompson School District, I think I mentioned in our previous, they did some initial discussions around this, but they opted not to move forward on training teachers and deploying this in schools. So we're looking to start exploring other ways that we can reach youth in this area, in this part of the county. As we go forward in this next 6 months, we're looking at how do we look in out of school settings as well. I know this grant is more specific around schools, but how do we reach youth in other ways, and how do we find partnerships and collaborations with other youth serving organizations where this might make sense to be able to reach youth in those areas. So that's something that we're going to be exploring in this next 6 months of the grant. Next slide. I think that is it. I will just note from a budget perspective, we're spending a little slower, but most of that is anticipated because of the survey and the media campaign that is taking place in the second 6 months. There is, I don't know whether we need to make, John, there was a small staff allocation change in terms of time allotment. It was roughly about $2,000, just of who doing the work as opposed to anything else. So that's small enough. Okay. So any questions?
Any questions or comments from the council? Yes, or
The clicks and impressions, those are statewide or those are like?
No, those are specific to Larimer County. So that's all geo-targeted media. So there has been some statewide media in addition to this that has gone out, but there is in the Connect Effects case from Rise Above more broadly, Connect Effects case, there is no statewide buy anymore. So the AG's office is no longer funding that at this point. So anything that gets done to support this campaign is really sort of at the level of the ROACs, and ours is one of the ones that is adopted, continuing to make sure messaging is getting out to you, which I think makes a difference.
What, do you know when that statewide funding change stopped?
The last, I believe it was the end of last year. So it's been 12 months since that's been out. So it'll be really interesting when we collect data to see awareness levels wise, what's changed statewide versus in the communities where communities like yours have doubled down on making sure that their youth get these messages.
Do you have age breakdowns on those clicks and impressions? Do you know who they were reaching more specifically?
It is 12 to 17 in our sort of target area. I don't know more specifically within that level what it is, but it is concentrated. We're reaching. There's always some spillover there based on what age youth say they are when they're accessing social media, but that's the intent.
Good. Thank you.
Yeah.
hands up? Well, can I do what I appreciate how this complements the work of Dr. Nathan Riggs over CSU Research and Prevention with the school district, as well as our work within the health department on tobacco and nicotine prevention. I think if you do that strategy this way, I think we're going to get better outcomes. But we are continuing to hear from our community partners and through our school districts the rise in marijuana vaping, the rise in alcohol stuff. So it all goes hand in hand with our youth, unfortunately, on that developing brain. But I think this is a targeted effort which complements the others. So I appreciate the work. It's not just opioids, it's all of that. And it's unfortunate it's impacting our teens and it's impacting them at a high rate. And I appreciate that work.
Thank you. And we welcome the continued collaboration opportunities that may exist. Again, when we're thinking outside the box, outside of schools too, are there opportunities with tobacco cessation and other initiatives in the county where, again, we use the complementary efforts, as you say, how do we leverage each other best?
I appreciate that from the very beginning, you've been very open to all the complimentary.
So do please, folks on the council, please keep us in mind for where those collaborations might make sense.
All right, motion to accept and free up the remaining 6 months of funding to Rise
I'll make
Above.
that motion, Mr. Chair.
Thank you, Commissioner. We got a motion.
I'll second.
Thank you, Mayor Pro Tem Mason. We got a second. Any further conversation? Hearing none. Anybody oppose that motion? Passes unanimously. Thank you for your work.
Thank you all. Appreciate you.
Okay, our next one is Larimer County Sheriff. Welcome.
Good afternoon.
Sergeant Cook, how are you doing today?
Pretty good. Thank you very much. Mr. Chair, members of the council and guests, today we're here to present our 6-month interim report for the current grant we have for the co-responder project that we've had for the last couple of years. We're going to make this presentation fairly quick. I don't have a PowerPoint because I want to save some room for questions because I'm thinking there might be some questions. But Lieutenant Van Hook and I are here to present and answer any questions you guys may have. So as you've seen in the written report, we've already met most of the goals that we had established in our original presentation to the ROAC. You've also seen in the written report that our expenditures have actually passed the amount that we were granted this year. As you all remember, this year was kind of a curtailing of the dollar amount. So it didn't cover our full expenses. We were able to receive $280,000. And obviously our expenses for the 2 deputies and the corporal that we added in the expansion project is about twice that amount. So we're already overspent as a department budget. However, we're obviously on track for the 6 months of the ROAC funding. As you've also noted, probably in the report, there's been several changes that are important for you all to know about that have been significant. As I put in the written report, LCSO and Stone severed our contract to provide contract clinician employees for the sheriff's office and our co-responder unit. So we don't have clinicians that are working directly with our deputies. In fact, they're not riding with our deputies as they had been before. Several reasons for that, which some of them were addressed in the written report. So I won't spend any time on that, leaving room for questions. But the other significant event that happened is the county's budget crunch. I think most of you who are associated with the county are pretty aware of that. That has had a significant effect on our unit as well. In that it effectively has reduced our team and our unit from where we were before to back to 2 deputies and a sergeant, which is myself. And that is probably going to continue into next year based on our budget projections for 2026. This has affected our staffing, but it hasn't affected the work that we're doing, except for the number of hours and the amount of coverage that we've been able to provide. But in spite of these changes and the effect on our unit continues to respond to crisis calls involving overdoses, substance use, mental health, and most commonly co-occurring conditions. The 2 deputies that we do have that remain in our unit are both very experienced senior deputies. They have a lot of experience in patrol, but they also have a lot of experience in our unit. Both of them have done a great job and continue that commitment and dedication to serving those in need in our communities. In addition, even though we don't have clinicians that are working with us and riding in our cars every day with us, we do have access to those clinicians. We're basically utilizing our relationship with Stone, our relationship with UC Health, and we're getting clinician support when needed from Fort Collins, Loveland, and Estes Park. So in conclusion, on behalf of LCSO, I'd just like to thank the Larimer County Regional Opioid Abatement Council for support and the financial grants that we received over the last 2.5 years, because this was able to allow us to have a significant positive impact on our community members and the communities we serve. We don't have the questions at this point.
Questions from council? Yes, Gordon.
Could you just give us a little bit of color sort of on how the deputies have been able to sort of keep up that work without the clinicians? And I guess maybe part two, are y'all, and I know there's, financial complications to this question, but are you looking for another partner besides Summit Stone, or are you just planning on going with deputies from here on out?
You start with the first, okay, and I'll hit the second one. So the work is continuing. Obviously, it's we have less coverage with only 2 deputies assigned to the unit now. So we have focused that time period during the daytime. That's part of our busiest time, probably from 8 in the morning till 6 at night. So we continue to respond to those crisis calls, whether it's substance use or mental health, or more commonly, it's co-occurring conditions that we most commonly encounter. And the deputies that are doing the work, like I said, they do have a lot of good experience. So when needed, we're able to get a mutual aid from Fort Collins, Loveland, or Estes Park, and they can provide that clinician in those situations. As far as the future goes, Lieutenant Van Hook can address that.
Yeah, so kind of talk a little bit what Sergeant Cook just talked about. We still have a great relationship with Summit Stone as an agency with Larimer County Sheriff's Office, so we do utilize their services still, just not in the same form and fashion. As for trying to get funding to have additional clinicians or to get back into that model, that's something we're very interested in. That was funded, from my understanding, it's never been funded by the Sheriff's Office. It's been funded through Larimer County PHA, and they are currently in a contract with Summit Stone. And so we're looking at into the future of how can we readdress some of those, or allocate some of those funds through our partnership with Larimer County BHA, and have either UC Health or even in some internal clinicians that would be hired by the county themselves. So we are looking at what could that look like into the future. To be quite honest, I thought we would be able to shift those funds that we currently were utilizing for Summit Stone and not have this disruption in service, but that has not been the case.
You have a hand raised in the chat from Trustee.
Trustee Youngland. Trustee Youngland, please. We see your hands up.
Thank you, Chair. Thanks for the presentation. And yes, I was quite disappointed to read about the split and the co-responding unit kind of being severed there. Because that was, I think our purpose in allocating those funds was for that to be developed, both with adding more employees, deputies, and vehicles and all, to make that co-responding unit grow and be productive. I understand and I appreciate all that you're still doing without that connection with Summit Stone. I have a little heartburn agreeing with the next amount of money being lent when we're not sure, how or where you're going to be able to create that co-responding unit again, and who that might be with. So I'm not sure, how we've never been presented with this issue that I can recall, the time lag that it's going to take perhaps to get this back up and going, probably, I guess, would be to just re-ask when you get things kind of straightened up, or the budget gets more in tuned. So I would like to hear from others about the possibility of how we can move forward with, do we just hold these funds or what? Because I'm not real comfortable allowing the funds to go forward without really our mission that we okayed these funds through. comments, please?
Mr. Chair, I have to ask for your excuse or to be excused. I have another meeting that I have to be on as well. Lieutenant Van Hook's going to stay here and answer any other questions you may have. But Trustee Young, I appreciate your comments and thanks for all your support.
Thank you, trustee, for your question. Others on the council?
I would like to jump in. First, a clarifying question, then I will talk to Trustee Youngland. So first, I want to just, Captain Van Hook, are you saying that the county is looking at hiring more clinicians or the sheriff's office?
We were hoping that at some point we could either have some clinicians through the sheriff's office. But again, that's all funding based. And if not, those funds that were utilized before from the clinicians through BHA that were in contract with Summit Stone to reallocate those funds, to either partner up with UC Health or use those funds in a different fashion, such as hiring clinicians through the county, that being the sheriff's office.
Okay, so Trustee Youngland, I think I agree with you. It is disconcerting. This has been something that has caused me a lot of angst. We worked so hard to get that up and have some great outcomes. I think this is a very complex and complicated path of where we're at today. And it's kind of hard to explain. I've been digging into it a little bit when I first started learning about it. I guess where I'm at is because I've asked this question, is the folk responder program, done? And I've been told no, and that there is still, things happening, and they're still partnering, and they're doing mutual aid, and they're trying to get folks to Longview and other facilities, and those deputies still have that specialized training, which I think is very important to have that kind of response. I do think there is some looking at how does this work going forward, and how do we bring the clinicians back together, and how do we ramp this back up, as my understanding. So my thoughts are, I think I'd much rather see something keep moving forward, because they're still using the vehicle, and they're still using those two deputies to get this services out, is my understanding. And then how do we finish out this grant cycle, and then give them a chance to show kind of the path of how they're going to kind of reorganize, restructure, and kind of increase and move ahead, because I do think it is allowed use, and it's been very productive, and been a lot of great outcomes from this. And I think it's a big, a lot of folks, I hear from that at the state level, at the conference, and other areas where they really have been looking at how we do it, and others to, because it is useful to have folks who are trained, since we're seeing, especially on the Eastern Plains and other places where they don't have as a great network and resources, behavioral health. They have all commented they would just couldn't even dream of having some of the things that we have in place. And one of those was the co-response. So that's kind of, I'd much rather kind of keep moving it forward, and then giving them a chance to come back and show us how they're going to try to revamp this and ramp it back up and keep moving forward. But I hate to just kind of take it down and keep the momentum, bring it to a complete standstill, when I do believe and have hope there's a chance to get it ramped back up. And there's a lot happening at the federal and state level with funding, and a lot of conversations, and a lot of things happening at the county to do responding to all these constant changes with our budget. And so I think it's a chance to see how we can do this differently. And there's another thing that I'm hoping we can bring forward that I think will align with some of your goals as well, Trustee Youngland. But I do think that it's something I would hate for us to completely eliminate. I do think we can, I am comfortable moving forward. I appreciate them coming forward and giving that report and being forthcoming, but I also think it would be great to give them a chance to come back with, after approving this, and let them kind of show how they're going to, detailed plan of how this is going to look different, or how this is going to continue in some form or fashion. So I hope that's helpful.
Yes.
I respond with just a couple comments, or I can leave
Sure.
whatever you'd like, Mr. Chairman.
Yeah, go ahead.
To give a little bit more insight into it, the sheriff is committed to this program. He sees the benefit of the program, and this was a very difficult decision on his part to cut this back, especially in the shortcomings of the budget throughout the remainder of the year. So his goals and objectives are in 2026, with hopes that we will have our program continuing and expanding at some level at some point, but he cannot commit to that at this particular time. Without these funds, the sheriff has kind of come back to what is his core responsibility and statutory responsibility. And unfortunately, the co-responder program is not one of those core responsibilities. And so without these funds, I'll tell you that the 2 deputies that we have right now that are currently exclusively responding and working with Summit Stone and with the clinicians could be in jeopardy. That's the last thing that the sheriff wants to do, and he has expressed that very strongly. So this is not by any means, this is not, hey, if we don't get these funds, those deputies will go back to regular patrol and we will not have this program at all. I don't want that to come across that I'm saying that will happen. But I do know that the sheriff has had to make some very difficult decisions, and even reducing the program with the hopes that it's only a temporary reduction and that we'll get it back up and at full force and even expand into the future is his desires.
So for me,
Yes, sir.
we have a grant contract with you. Are you able to meet the deliverables within the grant, whether it's Summit Stone or not, whether they're in the car with you or not? Are you able to meet the deliverables that are outlined in the grant for the next 6 months?
Yes, sir. We do believe we can meet those. Well, how we go about doing it will look a little different than what we have been doing traditionally. But yes, we can meet those, the deliverables.
Thank you for that. John, from your perspective with the grant, the grant doesn't spell how you do it. It's just, please do this. That's what you're going to do, right?
That's right.
Okay. Now, one question I had, I don't know if it's been answered. So when you had a Summit Stone clinician with you and you arrived at scene, they were right there. How long is it taking when they arrive on scene with your trained, highly skilled deputies to go, oh, we need help, make the call, get somebody there? What's that gap that you now have?
Sure. It varies, right? Depending on availability.
On the average.
And I'm sorry, I can't give you a time frame because a lot of it is by phone calls. Instead of having that clinician right there, they're able to make some phone calls with the connections and the relationship that we have with Sunstone. And so a lot of that communication has taken place right there on the immediately, if you will, because they're able to get the right person in line. If they're coming and responding out through the crisis response team of Summit Stone, it's taken usually 30 to 45 minutes up to an hour.
Okay.
Is I think would be a fair statement, 30 minutes to an hour.
What would you say is, because you've been doing this now, what, 2 or 3 months since the contract was?
Correct.
Yes, sir. And what's been the decline in service that you had prior? What are the things that are kind of unfortunately going backwards?
So I think that's a very fair statement. The hours of operation is declined. We have gone from the 4 deputies to the 2 deputies. So we used to have a clinician and a deputy partner, or at least one of them on from 7 a.m. until roughly midnight, 7 days a week, minus some vacations or sick time or whatnot. Now we've reduced it down to 7 days a week, 7 a.m. till 5 p.m. With that understanding right now, our stats are showing those are the times of service. With the summertime or the spring coming around, if we're still under this model, we're going to adjust those hours so that we're maximizing the time of those particular deputies.
But bottom line is you guys can fulfill the minimum requirements within
We can. It has taken longer, and it's taken some uniqueness and some of the relationships that we already have with our clinicians and our partners in Summit Stone. But we do feel that we are meeting the needs and we are fulfilling the obligations that we have.
Thank you for that. So for me, for the council, we've got a contract with Sheriff's Office. They met their 6-month requirement. Is that correct, John? if they are meeting the contract, it doesn't matter how they meet it, unless we spelled that out, sounds like we didn't, then I'm inclined to support the next 6 months because I have no reason not to. So that would come back from my opinion.
We do have a hand raised in the chat.
Thank you. And I'm not arguing against,
Have a hand raised in the chat as well. Trustee Sativa.
I'm not arguing against Continua because I'm very appreciative of the work Sergeant Cook's folks are doing in this trained environment, and I think it's valuable. But I guess I would push back on whether it's meeting requirements sort of as we've approved it, because I think we approved sort of co-response, and this is no longer co-response. Not to sort of be pedantic about the name of the unit, but it's not co-response. And so that's not an argument to not continue it, but I do feel like it's a different vision than what we approved. I would think if another organization was doing this, I think we'd find it pretty different. Now, again, we want to continue to support it because we support the work and we're hoping to get back with a co-response model. That's great. But I'm not sure I see it as the same.
Okay.
And just as a response to that, I'll tell you, I have very strong frustrations as well, because I felt that the money that was being allocated through BHA to Summit Stone would be able to be reallocated, and that's what is missing. Is that we want clinicians with our cars.
Yeah, it's not knocking
Yeah.
even Sergeant Cook at all, right?
Trustee Youngling, I understand your hand's up, and then Commissioner, you'll go next.
Yes, thank you. Yes, that's where I was getting at, is we approved it for the co-response unit. And so I don't feel like, even though they're doing a great job, do not get me wrong. I appreciate everything that you guys do and have done. But when I moved forward, it was because of the co-response piece. Also, if I recall right, we last allocation was given to increase the amount of time 24/7 or whatever, and now they're cutting back. So I would like that to be looked at as well. So I'm still not wanting to move forward. I'm wondering, and this is what I was trying to get at before, is there a way, and maybe David could tell us, or someone, is could we revisit this, not give them their 6 months, but have them come back to us in, say, 3 months, or when they have gotten things in shape to move forward with the co-responding unit and revisit that. I don't know if the contract would be that flexible. Thank
Was
you.
that a question for John or David?
I think David will have to look at it.
Probably David, I would think.
Yes.
David, did you hear the question?
Yes, I heard the question, and I think the comments I heard are accurate. I'd need to see the grant agreement that has been executed to see what the terms are and what flexibility it offers at this point.
Okay. Commissioner, your hand was up?
Yeah, I just, this is a complex situation, and I do think I agree with you. It is a co-response, but this program was unique because they were having the clinicians right along. And also we knew other co-response in the county, as I understand, the deputies are out. And then, I'm sorry, hold on just 1 second. I gotta answer this question. Hold on. That the deputies are waiting. I'm sorry, the police officers don't have someone in the car with them. They show up when they're called. And so I think Summit Stone's also kind of responding that up. So I'm just want to tricky. So I do think it is troublesome, and I do think there's a lot of complexity with the Captain's Van Hook, and I don't think that there's more complexity to this situation than what we can really share. And I just want to say that I do think and hope the sheriff is really committed as I am to getting this back on track and moving. And I think that there's things we can look at and talk about, but I do think it would be great to at least keep those deputies that are especially trained in that vehicle out on the streets to continue to do that and to at least be able to respond in that way until we can kind of get it back to where it was and or even I know our staff are researching innovative new ways to be able to do this and would be more efficient and cost effective. So I just wanted to share that as well. And if there's no further discussion, I would certainly make a motion to go ahead and approve this report in the next 6-month allocation with the caveat that we hope by the end of this, maybe 6 months, maybe some kind of plan or budget or idea of how this was used or some call numbers and also how next steps for trying to bring the co-response back into how it had started off when we first advocated and pushed for this.
There's a motion and we have a second. Is there further conversation? Is there hands up that I'm missing? I do want to bring up, I appreciate DA McLaughlin's points. I'm concerned approving this if David hasn't had an opportunity to look at the contract, determine if this change would not meet. So for me, I'm going to be a no vote on this motion until I can have a better understanding and voting that there changes. It is not a co-responder in the sense model that we approve. So I will no vote because I would rather hear from David if this is or isn't meeting the intent of the contract, because I don't know. So I just share that. Any other further comments before we take it to the vote?
I would like to comment. I agree, Chair. I don't feel comfortable moving forward with a positive vote here. My recollection serves me that this would not be correct in doing so, because I think it would be against the contract, but I will wait for David to weigh in at another time. So mine is a no vote.
Okay, further conversation?
Consider delaying it until next month until you've got more information, or do you have to make a vote today?
There's a motion, a second, so I have to entertain that. But yes, the question was, would you be delaying it? I would absolutely be in favor of delaying it to January, because to answer that question through our council attorney. But thank you, Jessica.
Mr. Chair, can I make a comment or is that improper?
It is, because we're deliberating, so thank you for that, though. I appreciate it. So I will call the question and we're going to do roll call. So the motion is to approve the report and to disperse the next 6 months of funding to the Larimer County Sheriff for the co-responder program. A vote of yes would approve the motion. A vote of no would not approve the motion. I'll start with the town of Estes Park. How do you vote?
No.
I'll go to the city of Loveland. Are you on?
Yes, and I would vote no as well.
I'll go to the city of Fort Collins. How do you vote?
That would be no with what's on the table now.
Thank you for that. I'll go to the town of Wellington.
Sorry about that, Chair. Yes.
Yes, vote. I'll go to Larimer County government.
Yes.
And the chair representing the Board of Health votes no. That motion does not pass. 4-2. Is there any conversation about bringing this up at the January meeting? Because that was part of the conversation. I would entertain a motion on that.
I'll make a motion, Mr. Chair, to delay this decision and move it to another future discussion in January.
Second.
We have a motion. Do we have a second?
I believe that was seconded by Chad.
Okay, thank you. I did not hear that. So we have a motion second to delay this and revisit it at the January meeting. Any further conversation? Hearing none, I will go to roll call. The town of Estes Park,
Yes.
the city of Loveland,
Yes.
the city of Fort Collins,
Yes.
the town of Wellington,
Yes.
Larimer County Government,
Yes.
the chair representing the Board of Health. Yes, that passes unanimously. With this will be put on the January meeting. And we'll ask David in the interim, could you please do a review and provide information back to the council regarding the question at hand? Is the change for the co-responder, does that impact the grant and the contract deliverables?
Yes.
Thank you, sir. Okay, moving along. We have number 6, Larimer County Opioid Abatement Advisory Group recommendations continue. So we will kick that off. Is that Laura Walker? Oh, there you are. I'm sorry.
Be first.
The Butler Institute. All right, thank you.
Hi, everybody. When I was here in October, we presented a set of recommendations from the Opioid Abatement Advisory Group around some of the processes to help support this council's capacity in how you both make decisions around grant funding and some of these processes like reporting and communications. I finished the presentation, but we did not get a chance for you all to have a discussion and consider the recommendations and which ones you were interested in moving forward or any tweaks you wanted to make to any of them. So that's here to continue that discussion today. I just want to confirm how much time we have for this particular conversation. I know in the email is somewhere between 15 and.
I think that's 15 would be, yes.
Okay. So in the interest of time, I'm not going to re-present all of the recommendations. We'll just, I do want to summarize a couple of key points, if you don't mind going to the next slide. And the next one. So again, just to remind everybody, the sources of information for these recommendations was an environmental scan of practices across all of the Colorado ROACs, at least to the extent that we could find them online. How are they doing their grant applications? How are they communicating about them? Those kinds of things. Feedback from the grantee interim reports that were coming in. There is a question on there about how can the council improve, things like that. And then brainstorming from the opioid abatement advisory group. And then Butler subject matter expertise, taking this information and providing a set of recommendations to try to get at maintaining the ROACs, principles of how you want to operate. The next slide. The three major categories of our recommendations were around communication and administration, the grant application and decision making, and the reporting and evaluation. Next slide. So again, the recommendations were all centered around increasing public awareness and transparency, which we know is a priority of the council. And then enhancing the ROAC's capacity, trying to create some efficiencies in the processes so that you do have more time for discussion, deliberation, considering things in real time and being responsive to things as they arise. Providing tools to support your decision-making processes, and again, building on your principles and established priorities. And then leveraging our current contract. We are currently contracted with the ROAC to support both ROAC capacity building and grantee capacity building through evaluation technical assistance. And so a lot of the recommendations we made, we can support at least through the current contract that we are under. I think we can just, I'm going to go ahead and scroll down to the last slide that we have because it summarizes all of the recommendations. So right here, yeah, sorry, one more back. This one. So a couple other things I want to say is the recommendations are really centered around maintaining the ROAC's ability to make decisions. Decisions aren't made elsewhere. This happens here, but providing tools to support the ROAC's decision-making. And then secondly, we did hear the feedback in the initial discussion that happened following our presentation in October around concern wanting to have the space for interaction with grantees. Because one of the recommendations you can see here was to replace the grantee 6-month oral presentation with some alternate format. And we heard the concern about eliminating that ability to have that interaction and that conversation face-to-face with grantees at that time point. So we do want the advisory group met in the interim and discussed and started to brainstorm some ideas. How could you still maintain what the council wants to achieve out of the 6-month reporting period and still try to create some efficiencies with it to best use both the council's time and grantees' time? So as a reminder, communication administration, we suggested some additional information on the website that would be helpful for the public. A streamlined contact mechanism for grantee questions that are then also reported out through the ROAC for ensuring that everybody has equal access to information. And then creating an annual grantee convening to that spirit of creating some cross-learning and collaboration among grantees. For the application, the group suggested developing a standardized scoring rubric that would be completed by an impartial review committee and then provided to the council when you're making your decisions for grant funding, and then exploring options for multi-year agreements. Reporting and evaluation recommendations were to replace the grant, I already talked about that one, replacing the 6-month oral presentation with an alternate format, starting to develop a cross-site evaluation approach, and establishing a process for regular community needs assessment and funding priorities review. I went through that very quickly because really what needed to happen today was the discussion among the council on where do you want to put some energy towards improving, tweaking, enhancing some of the processes that are established.
Wonderful recap. Thank you. Okay, let's open up everybody on the council. What are your thoughts? Any hands up?
Not yet. So just one right now, trustee Younglund.
Trustee Younglund, we understand your hand is up.
Yes, thank you, Chair. In thinking this over, as far as the 6-month presentations, I thought about perhaps if they are meeting their goals, there is no request to reallocate or kind of, if they aren't able to meet their goals, as this last presentation, we had some issues. If there weren't any issues like that, if it was pretty clear cut, I think a report is fine. A written report is fine. But I think if there is some wavering between, what they need for the next 6 months, I think that could be an oral presentation. I was wondering what the other board members thought of that. It might help cut down some, but give us opportunity to have a discussion, if there is some concerns.
So clarifying question. So trustee, that would be on at 6 months, there'd be kind of a question there. Are there any changes? Just like we had with the co-responder, or something you need to report out, or you didn't meet something. And then I guess there would be an evaluation from John and his group on determining whether they needed to come or not. What would be that mechanism to determine if they are meeting everything or not, determining if it could just be a report or they do need to present?
Well, I think the mechanism, if everything is status quo, they're meeting their goals, they're meeting all the expectations that they put forth to us, then it's pretty clear cut. I've found that we don't really have any issues moving forward. It's if they need to have a reallocation, if some things came up, like Harvest Farms have had some, then they need to come and present. But if it's pretty straightforward and things are moving and they're hitting their target or above target, they always outline what it is their goals are. And if they've met those goals, I think then just the written report and we move forward. If they haven't, then that's when it gets triggered and sent as a presentation.
We do have two hands in the chat.
Yes, John. John, are you responding to that?
Well, just in general, one of the challenges I see with me making that decision, if I'm reviewing and go, well, what if 9 of the things are meeting the goals or exceeding them and only one's under? Like Harvest Farm had some numbers that were below their target goal and some were above. How below does it have to be before you go, oh, that's not acceptable, we need to hear from you? And I think when they're at 93% of what they were thinking or something, whatever that example was that I saw earlier, I'm like, to me, that's close enough. But I don't want to be the one making that final decision without clear expectation.
Who's got a hands up?
We have two. Amy Phillips, followed by Brian Mason.
Let's go with Amy Phillips, please, from City of Loveland first. Your hands up.
All right, thank you. I would agree of somehow streamlining things. I think maybe one of the best things would be to ask them to submit a 6-month review, and then we as a department looks through it, and if something stands out like it did today where we have questions, that would be the opportunity to say that, so that it's not necessarily falling on staff to, as you said, determine is it one or this, because if you're not meeting one thing, that could be huge or it could be small. So I think having some way to do that, but to have something written that we can review and say, and then also, as you said, to have a rubric saying, has something changed? And for us to review that as well, but to give the opportunity for the board to review it and not put the onus on the staff.
Thank you, Amy, for that. I understand. Mayor Pro Tem Mason, your hands up.
Yeah, thank you, Mr. Chair. I do agree with a lot of what's been said so far. Obviously, I think we do need that 6-month review as far as a written document included in the packet, as has been up to this point. To Trustee Youngland's point, I certainly, if a reallocation is being requested or something like that, then absolutely. I think we need that grantee to probably come in and discuss that with the council so that we can determine a path forward. I think I could be in favor of all other things aside, assuming everything else looks good and the grantee looks like they're meeting their goals. The only other thing I would say is we need to have some type of avenue to reach out to that grantee with questions, whether that's right. So if the council is able to review the packet or the 6-month plan before the meeting, I do think there still needs to be some avenue for us to potentially ask questions via email or whatever that may be. But it's probably not necessarily that they need to come in person, like I said, assuming that most of the goals are being met. I think it was John that brought up the point that if a grantee is not meeting those goals, that is a little bit of the concern I have as well there, which is, there has to be some trigger at some point to say, well, they do need to come present and they don't need to come present. I guess I'm not defining what that is maybe not the easiest thing to do. So just throwing that out.
Thank you, sir. Other thoughts, comments?
We do have another hand raised from
Commissioner, your hand's up.
Thank you, Mr. Chair. Some great comments, great conversation. As you know, Mayor Pro Tem Mason and I sit on that advocacy committee, but first I want a clarifying question for maybe Philip. She had said something about referring to the department, and I wanted to know what department, or was she referring to us as a council of the board?
Sorry.
So I first want to,
as a council.
Yeah. And so and I'm not sure, Amy, I know you've been representing for a counselor had resigned. Do you know if you'll be staying on in the long term, or is the council going to reassign the representative?
They're going to reassign.
Okay,
so I'll be bringing on the person. I'll be bringing on the person as well.
Great. I appreciate that. I just was thinking about that. My next comment is, I do think there's some good recommendations here. I think also I want us to think short term and long term, as I keep saying that it's great. We've been moving very fast and getting lots of information out and lots of funding and grantees out and a lot of great work being done. But also, I do think we have to have a process in place because as Amy's knows, she's been here, but we had someone else before and she's coming, and to have this process and to help folks who are coming and going on the board would be really important in the long term. I think I agree with what I think maybe everyone, but Mayor Pro Tem and what Trustee Youngland had said, that if there are some challenges or some questions about the 6-month report, I'm wondering if we had if we get those reports, usually we get this about a week, the packet about a week before, but if the reports are coming in even sooner, if they would require us as a council to do our homework a little bit earlier and quicker, but if we had some major concerns, and there was a bigger issue like reallocating or something, that we could have them come in, and maybe that was what she was suggesting, is having a tiered response for that, so that maybe we have less and then the ones that we need to have a longer conversation on. And I'm wondering if we do our homework a little bit sooner, we can ask those questions way ahead of time or bring up our concerns so that maybe the 6-month review, they would be prepared to present on those questions right off, and might help make those, even when, if we do have someone come in person, it would be more concise because they knew what our questions or concerns were and they could respond to that more concisely. So I don't know what everyone thinks about that. And also the other thing I wanted to ask about was the annual grantee convening. I'm trying to remember, would that just be the staff or the full ROAC with the annual grantee convening, or with the opioid abatement advisory council? I'm trying to remember who would be calling that together and how would that what does that look like? Could you remind me of that again? Thanks.
Yeah, so the details of all of these recommendations really will get fleshed out once they're if the council agrees to move forward with any of them. So it's not yet fully established, but the idea there and the reason it was recommended is because there was some requests from grantees for opportunities for collaboration, coordination, strategizing across grantees. So the thought was it could happen in coordination with the BHS grantee convenings that occur. But just creating that forum and platform, there have been various ideas that have been tossed around, including maybe grantees are the ones reviewing and providing input to one another around their 6-month report or final reports and getting peer feedback from one another. So creating some form of a learning and coordination space. It is the full plan for it has not yet been established.
Thanks for that reminder. I appreciate it.
And along that line, I will just note too that if the council is interested in exploring some alternate version of a 6-month reporting process with some of these ideas that have been suggested, we can take this back to the advisory group and we can work on building out the technical plan of how it might work in getting John's input on that as well.
I think there's an opportunity to give a preview before the packet for sure. The current contract is structured that at the end of 6 months, you have 30 days to turn it in, not present. You have 30 days to turn it in to staff. And then we then schedule it for the next meeting, which is 3 to 4 weeks after you turn it in. So as soon as we get them, we could certainly release them to the committee. And I'm just pointing it out as there is a way to make that. Sometimes though we ask, can you do it a little early? Because we got too many at the same time, but that can all be worked around.
So I do want to bring attention to the council a time. It's 3:40. There's 9 items on here. We've been exploring 1. And we have like 3 more items here to discuss. And what is the purview of the council to go through all these 9? Because that will take up the whole time. Or would there be another mechanism to discuss this? I know we had tabled this from the last meeting. What are some thoughts and ideas? The whole application and decision making, that's a whole different process because we've been targeted. That's changing us to an application driven. Who's running this? The staff? Who's that? There's going to be a lot of questions and discussion there. So thoughts from the council on how we handle this right now.
do have a hand raised from trustee Youngman.
Trustee Youngland, you have your hand up, please.
Yes, I was just gonna go through and kind of briefly give my opinion on each one of these. So that way we could move forward. So
Before you start that, trustee Youngland, just in the interest of time, and I'm hoping you're healing well, by the way, and I'm glad that you're here. I'm wondering, just because I'm sure we all want to comment on things and looking at the time, if we could do a Google Doc where we all could, where she could maybe write in her responses on each one, like we could, and not reply to all, but we could, like a survey, and rank them, and then have a chance to write underneath, and then we could have all that together to look at for the next time. I know that's more work for us, but I think it might be helpful to let everyone kind of comment on each one, since there are 9, and bring have a chance to have everyone pull in their full thoughts. Just a suggestion. I'm open
That's
to.
actually a brilliant suggestion, because we wouldn't have time for everybody to go through that. With that, Juan David, is that okay? Just double checking. We're not, if we did it as anonymous and did a Google Doc or spreadsheet.
Yeah, that's why I already had camera on and asking question. I would need to see how that's structured, because even if you're listed as anonymous, if the only people that can access that are members of the voting council, then it's still a deliberation between them. As you can see, the comments, concerns, questions, all of that in real time. If there's a way to make it so that the presenter can give their information and you can make your own notes, and maybe those can be shared as part of the agenda or packet that goes out, and then the council gets those at the same time, then you're releasing it to the public at the same time you see it, and then you can discuss it at the next meeting. So it would depend on the format that you're looking at.
And that was my suggestion, Mr. Chair. Sorry to interrupt, but we have done this with, county commissioner, big statewide things, because we're all trying to vote on legislative priorities and things. And so we got a survey, and it was just for us to put we didn't get the whole congregation. We just put in our comments. And so I could see the survey where and you could make your comments and then rank priority, or yes or no, or whatever. Or like, do I 1 to 5, I like this or not? However that looks. I mean, I don't care. I just think it's a chance to just comment all of them. And then we come back and everyone can see, all, like, we don't even have to have the names. It could just be, I think even SurveyMonkey does that and just kind of shows which ones had more positive response or negative response. And I know it's more work, but it might be something for us to move this a little quicker and be able to look at all of it in aggregate. So I didn't want it to be in real time. I figured it would be something we could just put it in and then have us look at it together. So
that's something you can do.
I can do that. And we have a advisory group meeting in January that I can take that information to the group and bring it back to the next meeting.
With that, would council members, would anybody want to make a motion to move with that process?
I will so move.
Second.
We have a motion, second. Is there any further conversation? Hearing none. Does anybody oppose that process moving forward? Passes unanimously. Thank you. I apologize. And you keep coming, but I think this process will filter it down for us. Wonderful. Thank you for that. Okay, moving on. Approval of the opioid abatement advisory group charter continued. There's Laura Walker.
Swear mine will be short.
Welcome, Laura Walker.
Yes. So if you wouldn't mind pulling up, and if you go to the second page where there's highlighted text in the first.
There it is.
This was all we were left from last meeting, direction to clarify for everyone. And I know that Cubby mentioned this too when she was talking about the recommendations, to really reinforce there is no decision-making being made by this advisory group. And this couple of sentences here, we do not have decision-making authority, convene a group of individuals representing informed perspectives related to opioid abatement, and they will serve as a forum to gather this input, facilitate discussion, and provide recommendations to the ROAC, meaning all the voting members of. Are there any questions or concerns?
Questions, concerns, motion? To accept?
This was the only thing I was given to take back to the group and refine after we brought it to you last time.
I'll make that motion, Mr. Chair, to approve with this change and amendment to the charter that was, that is presented.
I'll second.
We have a motion and a second. Any further conversation? Hearing none. Does anybody oppose this? Hearing, see none, it passes unanimously. Brilliant.
That's gotta be a
Thank you.
record.
All right, we've been talking about code of conduct, proposing that. And our attorney to the council, David, has been working on that. So David drafted one, put it in the packet. David, I'll turn it over to you if you don't mind.
I'm happy to. I don't know if there's any particular questions. I just pulled this together based on some previous code of conducts that had been adopted for other entities similar to this one. So this is not necessarily unique to this particular council. It seemed to incorporate most of the main elements that have been adopted by other councils and commissions. So we put this together as a draft. It's certainly open to modification if the council decides it wants to change anything in there, and I'm happy to answer any of the questions about it.
Okay. Okay, Commissioner, your hand's raised.
Thank you, Mr. Chair. David, first, thank you for all the work on this. I think it's really important. I think it's especially, like I'm saying, we're looking long-term to provide some structure and also just some code of conduct. You know, like I have this in a lot of my state, national, and local, and our local county meetings. And I appreciate all your efforts on this. The only question I have, I do agree about having the meetings, if you're going to participate remotely, having the camera on and the microphone and all of those kinds of things that's on there. And I'm just trying to be thoughtful because I had this happen a couple weeks ago when I was flying back to DC and I could not get onto the Wi-Fi, so I had to go on my phone and then my camera wouldn't work. So if there is something that comes up amiss that maybe the chair, like the member could, not regularly, but just like maybe they're flying for a death in the family or something where they have a little bit of a challenge but don't want to miss the meeting. Is there a way that they could talk to the chair and just ask for a one-time excuse or one-time grace period to kind of not be able to call in with the Zoom? Because sometimes we have Zoom and call-ins, but just not regularly, just to maybe a one-time or once a year kind of thing, just to be flexible and thoughtful if people have extraordinary circumstances, which I seem to be having weekly now. So.
I want to make sure I'm not just jumping in if that question's aimed to me. Okay.
Well, maybe everybody. I mean, I don't know what everybody thinks about that. I do think it's important people have their cameras on and participating. But let's just say, you know, someone has a very unique circumstance.
The short answer is that yes, this is the code of conduct that the council would be adopting. So if a situation arose where one member did not have a camera, I'm assuming camera is the most likely situation to come up, could not access a camera to be able to visually participate, but could participate by microphone or audio. If the council approves it and says, yes, we, under the circumstances, we don't find this to be a concern, then that would not be a violation of the code of conduct. So it would be open to the council being able to address unique situations as they rise.
That's helpful. I just wanted to make sure we had thought about all contingencies in case, you know, I don't think I very often am not able to come in person. So, but logistically, it just kind of didn't work out today. So I'm just trying to be thoughtful, considering some of the other challenges people have had too. So thank you.
Any further questions or comments regarding the proposed code of conduct? Is there a desire to move forward to adopt this by the council?
Mr. Chair, I'll make a motion to adopt this code of conduct as presented.
Thank you for that. Is there a second?
Second that. And thank you very much. I was going to mention that. Thanks, David.
Motion and second. Is there any further conversation or questions? Hearing none. Does anybody oppose adopting the code of conduct for the council? Hearing none, that passes unanimously. Thank you, David. We now have a code of conduct that I assume we all need to sign here shortly. We'll get that out for signature. Next one is proposed revision to the bylaws. If you remember last meeting or meeting before, we talked about there was some inconsistency on term limits in the bylaws. So we asked David to take a look at that as well. And if you scroll down, I believe it's highlighted where the changes are, if I'm correct. David? Maybe not. David, can you point out where the changes are or addition into the bylaws?
I can. I'm gonna have to pull up my version of it.
I think it's under membership, if that's such a thing. A little more. Right, maybe meetings.
So if you're under membership, it's Article 3 on page 2. There's that section. So there seems to be a few different. I don't know how large mine is. My picture shows up on yours. I have a red line version that I can share on the screen if I have that ability.
I stopped sharing. You should be able to share now.
That would be great.
Okay. I just want to confirm, Mr. Chair, that is now up on the screen.
It is. Thank you.
And large enough that everybody can see it, I hope.
Can everybody see this, or?
Did you go one notch bigger?
One little bigger, if it would help. That didn't make much sense. A percentage or so.
Down
bigger. There you go. There we go.
Okay. For the most part, some of this was just to clarify who would be making determinations on participation and deliberation. Historically, the chair is the one that's responsible for identifying those that are called on. So we just cleared this part up to identify that it's the chair, not the entire council, who has to identify somebody else in the room to be able to add a comment during deliberations. Advisory members who do not have a specified term were specified for 2 years. I believe there are a number of different members, not the voting members, but the rest of them that do not have clear defined term limits. We didn't specify that they could not be reappointed for any specific duration, but it was just every 2 years they needed to be readdressed. The rest of this tends to do with the definition of the subject matter experts. They're going to be allowed to participate in deliberations as determined by the chair. So if there is a subject matter expert or I don't want to go too fast, advisory members also are going to be identified by the chair. So that's just to make those consistent. The entire new section that was added there is to address how deliberations would function. It is intended to be informal, and it will basically be run as you've been experiencing it, where the chair is the one that identifies and calls people and allows them to participate in the deliberation. I'm going to do this slowly so that I don't make anybody nauseous. We added the bullet point to comply with the council's code of conduct. This is attached as Exhibit A. Since you've adopted the code of conduct, that's what will be attached as Exhibit A to the bylaws now. And that is all of them. Yeah, I'll stop sharing if nobody has questions, but if you do, I will leave it up here.
the commissioner.
Okay, Commissioner, your hand's up.
Yep. So David, I should have maybe contacted you soon, but could you scroll back up just a little bit more to the item number 2? It's determined by, whoa, back there, yeah. Let's see, advisory members, structure may be allowed to participate by the council as determined by the chair. So, is that, the advisory members, that's all the advisory members? That like, we have, is that just the, subject matter experts, or is that all in my advisory?
So the council's broken up, obviously, into voting members, advisory members, and subject matter experts. The intent of the modifications as proposed would, during deliberations, right now, the voting members have a right to participate in deliberations. The advisory members could have participated in deliberation as determined by the council. But as over time, it's been sort of displayed that it's very difficult to have the entire council just vote how people will participate. So as a matter of normal course, the chair has identified that advisory member to participate in deliberation by allowing them to answer questions, ask questions. Same has been true for subject matter experts. So this is just sort of codifying the practice that's already been in place so that the advisory and subject matter experts can participate.
And then, some are subject matter experts, but certain folks have certain human services there, the the district attorneys there. But before we had did interviews and appointed this lived experience, but I don't see that in here spelled out. We kind of just voted on it. And I didn't know if we needed to spell that out in the bylaws, because that was voted on and approved and appointed through the council. And so if those are 2-year terms, we might be opening that up and have a process and have applications. And so I don't know if we need that spelled out in the bylaws, or what does that look like?
We do have it in the regional IGA. So Exhibit X of the IGA that sets up the structure identifies the groups of people that are voting members, advisory members, and subject matter experts. And they can be added to, the subject matter experts could be added to, or the council could vote to add somebody to an advisory member, but the categories themselves are already spelled out in the IGA. So we didn't relist them since we can't modify the IGA through the bylaws.
But I just want to clarify my question. The subject, I'm sorry, the lived experience, maybe I wasn't clear. The lived experience folks, when we brought them on, we had them do applications, and then 3 of us on the council interviewed them, and then we brought forth the recommendations for the council to approve the appointments. Do we need to have that spelled out in the bylaws, or is that just a process that we could mention the bylaws, and how does that work? Because I think those are the only ones that we, as a council, that only positions were the subject of the lived experience were the ones that we voted on and appointed and did interviews or brought recommendations. How would that be handled?
Yeah, I appreciate it. I understand the question now. And the process on how the council appoints or identifies the lived experience advisory members, that's not spelled out in either the IGA or the bylaws at this point. If the council's desire is to spell out how that process will be established, they're welcome to do so in the bylaws, but it's not required. The IGA, the regional IGA, says that they will be appointed by the council, but it doesn't spell out the process. So if the council approves the process, then that is a perfectly fine way to go through it. You can exercise that process, bring them to the council, and then they can vote on them. Then if the council desires to change that process at any point in the future, they can do so just by changing the process. If we put it into the bylaws, then you would have to follow that process, and the only way to modify it would be for the council to come back and vote to change the bylaws.
I appreciate how you just presented that. So if that's the case, then, and we can address that process later, then I would be okay with these bylaws as presented, and I will make a motion to approve as presented with the amended changes. And thank you.
We got a motion. Do we have a second?
I'll second that motion.
We got a motion, second. Any further conversation? Hearing none, that passes unanimously, or we have proposed revisions to the bylaws are updated. I do have one item to throw on the agenda. This happened about a year or two ago. The COAG, the Colorado Opioid Abatement Council, has their infrastructure grants. Well, many of those infrastructure grants require a letter of support from the Regional Opioid Abatement Council. We have been approached, the health department has been approached to partner up with the Colorado School of Public Health to do naloxone kiosks. We want to complement the work that MJ's team's doing at NCHA. I'm going to turn it over to Dr. Olson, who's got the letter. We just need a nod from the council that they would support a letter for this agreement to take place. So, Jared.
Yes, so as Tom mentioned, this is a grant that's coming from CU Anschutz and Trailhead to support within partnering counties. It's for 2 kiosks as well as some of the ongoing support for refilling those. So it's a very small component relative to what NCHA is doing, but perhaps something that can support the overall efforts and fill some gaps. So read the letter. Or just did everybody have the copy of the letter?
They don't, because this was just hot off the press.
Okay. So I'll quickly read the letter. Would that be appropriate?
David, so we're not causing any problems here. I know this happened a couple years ago, and what's the protocol here?
If you can clarify for me, the letter that's going to be read is from whom?
So this is so the participation in this grant program requires a letter of support from the Regional Opioid Abatement Council or wherever that program is going to be implemented. I have a letter of support that the council would need to endorse in order to participate in this program. They would like an answer. They didn't give us a lot of time. They would like an answer next week. So this is kind of our best opportunity.
Okay, and so if I'm understanding, you're going to read this letter into the meeting, and does the agenda itself have a identification of this occurring today?
It does not, because this just came up. That we had that happen a time with the sheriff's office needing a letter. I can't remember specifically. I don't know why the COAC does this, because it's hard for regional opioid abatement councils to get this kind of vote, and when they give us a week's notice to get information back.
Would it be possible if since it wasn't cited on the agenda and we don't have time to notify it, if we could just get a sense of whether or not the council would be in support of this, refer that to the grant organization, and then they would maybe take that as a placeholder
Not
until
a letter, just
not a letter, just we do believe the council will endorse this. Can you hold on that until our next meeting in January?
If there's a discussion item that you want to have without voting on anything, you can't take any official action on it today.
Okay, thank you. So do we even have a quorum? I don't know if we do anymore. We don't, do we? No, we don't even have a quorum.
Okay.
This is one of the challenges with the infrastructure grants. They require letters from regional opioid abatement councils. It's difficult. I know others have had this challenge as well. So we'll just tell them that we can only get on in the January meeting. Thank you, Jared.
Yep. We'll put it in the next packet.
One other change is change to the January 2026 lineup will be the Abundance Foundation. That's 6 months or their final.
Insertion spot.
And then CSU will be in February 2026. That is different, but Abundance is.
They will be added in for January.
And is that the 6 month or
I believe insertion spot.
we believe it's their 6 months. So we'll update the monthly commitment starting for 2026 as they start rolling out. Any further comments or questions for the matter of the good? Do I have a motion to adjourn?
I so move.
All right. Thank you. Meeting's adjourned at 4:05. We covered a lot of ground. Thank you, everyone. Have a wonderful rest of your week. Happy holiday season. Thank you.
Thanks, everybody.
Thank you.
Hey, Tom, this is just in a PDF that we could have passed around so that we can share it.
We'll share that with everybody. Yeah.
The It's always on the back of the agenda.